I first met Mark Wardle when he joined the Utah campus of Rocky Vista University down in St. George, and I was part of his interview process, got to hear about his background experience in residency and clinic and see his passion for teaching, and he was a natural fit to join our team, and he quickly became a close friend as we got to teach together and work alongside each other. In working with Mark, it became clear that he had an incredible passion for the students. He understood the impact he was making on a future generation of physicians, and he had already made that mark in residency and teaching prior residents. But when he then was face to face with our own students there in Utah, you could just see him shine as he mentored, as he inspired greatness in them. I especially got to see Mark in a clinical setting when he and I did global trips. He engaged with every patient on a very personal level, getting down eye to eye with them, speaking their language, and connecting with them, helping understand in a very culturally aware, sensitive way how best to help them, and taking those students alongside him, helping them to engage with the patient in the same high level.
You know, Dr. Wardle, he's my school's Tracks and Special Programs Department Chair. He's also the Associate Professor of Primary Care, and he's also the Director of Global Medicine. And I am part of the Global Medicine Tract. Even in another country, he is an excellent teacher. You know, I've witnessed him teach not just students, but also patients, right? So when we are overseas, he will take the time to explain the diagnosis to the patient. He will take the time to explain why he's giving a certain medication or why he's wanting to do a certain type of management, and also explain what that means to the patient for their future.
I think one of the things that's so great about Dr. Wardle is how much he cares about not only the content, but also making sure that we're engaged and making all of these things more interesting and more fun, and it always helps it stick better. Like just last week, this is Global Medicine Track, so one of the things we did was we simulated what it would be like if there was a medical emergency on a plane. And we come in to our multi-purpose room, and Dr. Wardle has set up 3 different makeshift planes by encompassing these areas with tables, and he had these little plaques up front that were like RVU Air, and then it had a little slogan on it that was the best of the best or something like that. And then he had background music that was a YouTube, a 10-hour white noise of an airplane. And then he even had a microphone that was all right, please everybody take your seats, get ready to go on Rocky Vista Air. And I think I was really glad that happened, because it was such a perfect example of just how much he cares and was willing to go the extra mile for his students, because he didn't have to do that at all. He could have just set up the chairs and been all right, let's do this. But he got all of these equipment bags, put them together, made all of these different scenarios, and it ended up being really fun, and it was super memorable. And now if I ever am on a plane and I have to be that person that helps out, I'm gonna know that I have to call ground control.
And I first met Dr. Wardle in my first year at Rocky Vista. Just, I guess, a little bit of background on me, because it is maybe relevant in my connection with him, is in my first year, I actually matriculated in 2020. And I really struggled with COVID and the isolation, and it was my first time being that far from home. I'm from South Dakota originally, and so at about November time in the first semester, I took a leave of absence, and Dr. Wardle was incredibly supportive of that and assured me that I still would have the opportunity to participate in the global medicine track, which is really one of the things I was the most excited about for medical school, because I really saw that as kind of being a launching point for me, and would really be like the foundation of a lot of experiences I would hope to have in medical school. And he spent a lot of time reassuring me that this was a good decision for me, and just being really supportive throughout that whole process, which was very, as a medical student, you never think that that's going to be you. Instead of being in that position is, there's a lot of feelings with that. And he was always so supportive and very, very kind and understanding, and really just gave me that assurance that when I came back, there would be a place for me. Applied to be in the track again, and at this point I'm very familiar with Dr. Wardle. I actually got diagnosed with Hodgkin's lymphoma and had to take another leave from school. Yeah, so it was really difficult, and it was about the November time. It was almost like exactly a year later. So lo and behold, I had to take another leave. I had to, go back to South Dakota, get treatment and everything. And when I knew that I would be coming back, or hoped that I would be coming back the next year. And again, throughout that whole process, and talking to Dr. Wardle, he was aware of my situation. He's like, I just want you to know, like, you really do get to be with us next year. We're so excited to have you. And just was so supportive to me, and like made sure that I still felt connected to RVU when I was in treatment. And then when I came back, just, was so welcoming with open arms, and really made me feel like I was a part of it, even though I had, had all this distance and had all these kind of breaks. And thankfully, when I came back that third time, I did get to stay and followed through to where I am now.
It's interesting because when I think back on my memories of Mark, they're all things and qualities and characteristics that he had all along. In other words, it's like he came with the most important characteristics of being a successful resident and a physician, and we didn't really have to teach him those things. But though it's funny, the things that I remember about that is, kind of quirky. Like I would say, talent number one is that he was a juggler, and he could juggle like a circus clown, and he was fantastic. And number two, he had a passion for Spanish language radio, and he can out Shakira, and just was tremendously skilled. And number three, he was relentlessly positive and responsible. And when I had a family member who was having a complicated pregnancy and needed a C-section, I called Mark, and I just really appreciated his readiness and willingness to be there. And but again, all those things were, all those skills, talents, and just innate characteristics were who he was at the beginning and who he was at the end, and he was fantastic. Somewhat selfishly, being able to kind of check in with him periodically, and he doesn't know this, I don't think, but his adventures of being in a small town early on, and just his experience of learning about politics in rural health, and the quirkiness of being a doctor in a small town, the terror and the excitement of having real emergencies in places with limited resources. The stories that I've been able to tell, he doesn't realize that he was the hero of many stories that I shared with medical students and residents over the years, trying to illustrate how great medicine can be, and how interesting it can be, and how challenging it can be. And so he's educated a lot of medical people over the years unwittingly.
I first met Mark Wardle in residency, so we were in the same class at the Utah Valley Family Medicine residency back in 2005. So he became one of our chief residents he was just always, I would say the things that I remember most about Mark is that he was always happy, always just, a happy person, and was always trying to inject humor into things. And whether it was him juggling or, trying to balance a chair on the tip of his nose or his forehead or something like that, he was always trying to, bring some humor into the room and just help us, get through residency.
I got to know Mark way back when in residency. So I started as an intern at Utah Valley Hospital and in 2009, and Mark was there. He had already finished his residency and was doing a fellowship in rural medicine, and that's where we first met. And I remember Mark just being one of the most kind-hearted, compassionate people I've ever met, and seemed so well suited for a rural community, and someone who is truly compassionate about taking care of those populations. And I think his skill set of being a listener is something that is unmatched. And for him to be able to connect with all different types of populations and being able to care for them, whether he's educating or educating a student, or he's just trying to listen to the patient sitting in front of him, he is able to connect with people because he's willing to listen and willing to hear the stories and be able to respond in a way that makes sense in that context.
Mark, congratulations. Couldn't be given to a more deserving person than you. I'm grateful that we have a friendship, and I've been able to see all the wonderful things that you do, and the fact that you also now are spreading that to the next generation of physicians, I think is wonderful for our specialty in family medicine.
Thank you so much, Dr. Wardle, not just for your example, but for your guidance and for reminding us that the heart of medicine is often found in those quiet, generous acts of kindness and teaching. You are more than deserving of this award, and congratulations.
His enthusiasm now at the medical school, in Southern Utah right now for international medicine, and just kind of the gusto that he leads that with, and inspiring students. Everybody knows him, and everybody appreciates his interest in them. And so I think it's incredibly well deserved.
Mark, I am so proud of you. I'm really excited to hear that you have won this award, and you're so well deserving. Your positive demeanor and your ability to bring joy and happiness to any situation is something that I really believe makes you who you are and makes you an even better doctor. But I definitely look up to you, and I always have. Just be from intern year, knowing that you had just finished residency. That's something that I don't think will ever end. So you being a mentor to me and many others along the way has been a huge part of my life, and so I'm super grateful to know you, and grateful that you have been honored in this way. So congratulations.
Congratulations on the Family Physician of the Year award. It is well deserved. I have admired you and the impact you've made in your clinical practice and in your mentorship and teaching of students for several years, and I know you will continue to make a positive impact moving forward. I thank you for your friendship and wish you all the best.